I would like to come to talk to you about healthcare and why I believe it should be given free to all U.S. adults and why you should believe it too. My goal today is to help you understand why it is essential for us to not worry about another bill that is an only amount of money to pay. There are three classes of income that we use as a rule of thumb to judge where people sit based on their salary. The low class, the middle class, and the rich. Free healthcare applies to all of us for the reason that it is a basic human right and no individual deserves to be burdened by paying for either health insurance or medical bills. This is a very achievable reality in which I believe only will take some convincing to be achieved. It is without a doubt that our government tries hard to make us their top priority, but this is one area they lack severely at. Even our own servicemen, man or woman, do not get the greatest health care benefits supplied to them, although they put their life on the line for us daily. You might say that this is a drain to our economy, but I believe it is an investment. How we can provide free care free of charge that in turn would reduce the burden of paying these bills, ultimately saving money in the long run. The more healthy our individuals are, the more productive they are, which contributes to the growth of our economy. Resurfacing back to the old rule of thumb to judge people's wealth, I believe that our health care should not be dependent on if you can pay for it or not. Free health care should eliminate disparities in health care access. Granted, there would obviously be an option to pay for a higher grade version of healthcare if anyone is willing to pay for those prices. I believe this is how we could level the playing field, especially when every U.S. citizen is born with the right. Throughout history, access to healthcare has always been an issue with groups of marginalized people who are often neglected or denied essential medical services. From this article made by author Umar Sam, back in 2017, he talks about a country in Africa named Burkina Faso implementing free health care policies for women such as childbirth and children's health care services. He goes on to say that there are many other countries that have also implemented this back in the early 2000s. He stated that we now know that around 80% of maternal deaths and up to 70% of newborn deaths would be prevented if the right to health care was provided. If that does not show how beneficial a free healthcare system would be for just women and kids alone, I do not believe you understand how crucial it is for our next generations to be healthy and well taken care of. This is just one of many great examples on how free healthcare is beneficial. Countries around the world have free healthcare systems that have already been successfully implemented to ensure access to medical services for all citizens. In Canada, for example, the government provides universal health care coverage through a publicly funded system. This means that essential medical services, including doctor visits, hospital stays, and surgeries, are all available to citizens with no direct cost to them. Another example is countries like the United Kingdom, or UK for short, and Australia, alongside many other European nations that have implemented comprehensive healthcare systems that offer either free or heavily subsidized medical care to their communities, funded through taxes and government budget and contributions from employers. These countries have shown to prove that not only is free healthcare essential, but it also helps with significant improvements in the health of citizens, also demonstrating that free healthcare is a feasible thing, but very useful to ensuring the well-being of humans. The reason why I believe in free healthcare for our public is because free healthcare helps facilitate early detection and treatment of diseases, reducing the spread of illnesses, and improving the overall health of our citizens. This promotes new preventative measures and vaccinations and screenings, which in turn will lead to a more healthy population and reducing healthcare costs in the long term. The implementation of free healthcare is not just a matter of policy, but a moral right and an economic necessity. And just another great step towards social equality and public health. The time has come for our health to become a top priority for our government, while letting them know clearly that it is not a luxury but a fundamental right. Thank you.